I'm going to be sharing with you the results or the findings of a new study that was just published probably about a week or so ago. And it's talking about injecting the stem cells into the brains of MS patients with progressive multiple sclerosis. And they found that doing so, it is safe, it that it was well tolerated by the patients, and it could potentially protect their brains from further damage for approximately a year is what they tested, or how long they did this study. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And I was diagnosed with multiple sclerosis over 35 years ago. And since then, not much has changed. We now have at least 25 approved drugs, disease modifying drugs to treat multiple sclerosis, but we don't really have a lot of treatments for progressive multiple sclerosis. There is one that's approved. I'm not going to say the name of it, but there's very limited treatments for progressive MS. And what I want you to think about is like, are you guys done with treatments? Would you like a cure? We're just not happy with treatments, because really with the treatments that we do have, they're saying, and I found this really fascinating in the study. So we do have the 25 FDA approved disease modifying drugs for MS, but people still become disabled while using them. And what they shared is that 2/3 of patients with multiple sclerosis will still transition into a debilitating secondary progressive phase of disease within 25 to 30 years of diagnosis. So this is with using our current disease modifying drugs. That's not very promising. So at least 2/3 of us are going to progress from the relapsing remitting, where we get an attack and we get a little bit of a break in between. Our immune system can recover. We can get a lot of our mobility back. Eventually, that no longer happens, even with using all of the current disease modifying drugs. So is this new stem cell treatment, is it groundbreaking? Is it going to really help decrease or slow down or stop the progression, improve recovery, or is it just more of the same? So with multiple sclerosis, there is, again, the relapsing, remitting, and the progressive, and this study really focused on progressive multiple sclerosis. But that just means for people that have usually had it longer, it's still multiple sclerosis. So this is a 2023 study, clinical trial, published in November of 2023. The name of this study is called Phase 1 Clinical Trial of Intracerebroventricular Transplantation of allogenic neural stem cells in people with progressive multiple sclerosis. And basically, what they did in this study, they had 15 participants. These were people that had progressive multiple sclerosis. So they were older, they were in wheelchairs, they were bedbound or in wheelchairs. They were really afflicted with multiple sclerosis for more than 15 years. And they had advanced secondary progressive MS. So this study it's called an open label study, meaning that it is not a double-blind placebo-controlled study. The nice thing about a double-blind placebo-controlled study is that and maybe they couldn't do that ethically, right? How can you inject something else into people's brain or stem cells? But it would have been really nice if somehow the people that were measuring the results would not know if somebody had the transplant or not. When you are, let's say, a drug company and you have a product and you know that this participant took your drug, then it's the human biases come into play, and they might be seeing benefits that are not really there. So this is not a double-blind placebo-controlled study, but it is the first in human phase 1. So it's the first phase of this study. And now that they got results that were promising, what they consider promising, they're going to continue on with the second phase. Just one sec, I'm going to grab some water here. All right, so they're going to continue with the second phase. So this first phase was really to determine if it was possible to basically inject stem cells from fetuses that were apparently miscarried. So they took neural stem cells from fetuses and they injected them into the brains of people that had secondary progressive multiple sclerosis. And they injected them into the ventricle part of the brain. But what's really important to consider here is that they also injected immunosuppressive drugs with the stem cells. And that can really impact the MS also tremendously. So this is where that double-blind placebo control, like where one person or one group will have the stem cells, the other group will not. And ethically, they probably can't do a group without the immunosuppressive drugs because they give the immunosuppressive drugs just to make sure that in case they have a Herxheimer reaction, that they're not going to end up dying. So, but when you're injecting immunosuppressive drugs, like, is it the immunosuppressive drugs that is giving you the results, or is it the stem cells? We don't know. This study, they followed the participants for 12 months, so for 1 year, and they found that none of the participants showed an increase in disability or a worsening of the symptoms. Additionally, none of the participants reported symptoms suggesting a relapse or significantly worsening cognitive function. So what I don't like about this is, like, what were the benefits? Like, so maybe they didn't really notice a huge worsening within 1 year, but would they have been worse without the treatment? Like, I don't know how quickly, everybody's different, right? And so this is a really big red flag. And let me know what you think. Like, are you interested in treatments that could possibly not give you an extra relapse for a year? Or would you like to cure the multiple sclerosis? Would you like to recover? This, it's not showing any strong, like reversal of symptoms and recovery, etc. So the researchers concluded that the stem cell treatment is possible in humans. So yes, it's possible. People survived. They didn't have severe adverse effects. It was tolerated by these secondary progressive MS patients. And with higher doses, they had less decrease in brain volume. So with multiple sclerosis, but again, how much less? With MS, they're finding that the brain volume decreases over time, so they were able to measure that there was a slight improvement in that. So the limitations of this study is that 15 participants is a very, very small study, and it was a very short duration, 12 months. And if we're looking at 12 months, we really don't know, like, the efficacy or the safety long term. Maybe it was the immunosuppressive drugs that helped them for several months. And maybe after a year's time, then all of a sudden they'll start progressing again. It was not double-blind placebo controlled. And there could have been other confounding effects, like the immunosuppressive drugs that were also injected into the brains of these patients. And then also, when you put a catheter in the brain of a person, that's a very invasive procedure, and that could have risks. Also, so it's invasive, so there could be risks. It's invasive, so it's really not clear if this is going to be expanded to a larger number of patients. And then the whole fetal line, the fetal cell line, or I should say the stem cells that are derived from fetal cell lines, many of us would have real ethical concerns about that. It's one thing if you know absolutely sure that the fetus, we call a baby, that's what I call them, developing baby, if it was literally, honestly, a miscarriage and they were able to save it that's a whole different thing. But there are so many, like, there's this huge I'm not even going to talk about it here, but you can look into it yourself. A whole industry of aborted babies and parts and pieces used for all kinds of medical things. And personally, I'm not okay with that. And if it, like I said, if it was a truly, like I would be much happier and I would be okay with if it was my own stem cells, but not from a fetus. So that could really open up a whole can of worms for ethics. So I think for me, the biggest thing about this study is that, to me, it feels like more of the same. They keep saying we just need better treatments. We've got 25 treatments for relapsing remitting. To at least 2/3 of people that start off with relapsing remitting still progress to progressive multiple sclerosis in time. That tells you right there that the disease modifying drugs are not very helpful. And then when you have the progressive multiple sclerosis and you use this very, very expensive, invasive procedure, how long are the results going to last? And does it really make a difference in our quality of life? They're not talking about reversing MS. They're talking about, well, these people didn't get a lot worse over the year. And I don't know about you, but I'm really sick and tired of hearing all of this, like the new research coming out. It's always the same. It's always, we've got to find better ways to suppress the immune system. We've got to find better disease modifying treatments. It's like, no, how about we get this amazing group of researchers and practitioners that look at the work of doctors like Dr. Alan McDonald, pathologist, where he found small roundworms in the spinal fluid of every MS patient. How often is that? Is that always? Can we reproduce his results? Also, he found developing tapeworm larval cysts in the central nervous system of the spinal fluid of every MS patient subject that he tested. So, and these were people that had passed away. So, can we duplicate his results? He did it on a shoestring budget. He did not have to spend millions and millions of dollars to do these studies. He just got the spinal fluid, the remains from research brain banks, and he analyzed them, and he found these worms, the roundworms mating and in clusters, and all the debris from these worms in the spinal fluid of MS patients. We know that for at least 100 years, there's been this very strong scientific link between MS and the bacteria that causes Lyme disease. We also have over 100 years of research linking MS to a protist, which is a single cell parasite that causes, it's similar to malaria. It definitely infects our red blood cells, but it's called Babesia, or similar to Babesia. I don't know if it's always Babesia or if there could be other protists that are similar. And we know that for many, many years that fungal overgrowth is really common in multiple sclerosis. Researchers are finding that fungus growing in the brain cells, in the nucleus of brain cells. So we have all of these different, and I've shared tons of research about the dysbiosis and about the different toxins that are produced, the neurotoxins that are opening up the blood-brain barrier and making our blood-brain barrier leaky. And then these parasites are getting into the central nervous system. So why is it, and I keep asking this quite often on my live events, why is it that the experts, this panel of experts, an international panel of experts that decide how we diagnose and we treat multiple sclerosis, why is it that they are not interested in looking for infections? They are laser focused on just finding ways to suppress our immune system. And with the stem cell this is not a stem cell transplant, but it's as like injecting stem cells into the brain. Again, this one maybe is not as immunosuppressive directly. It may potentially provide a little bit of immune modulation when you introduce those novel or new stem cells, but is it giving us our life back? No. If you want to see what works, go to Live Disease Free, our YouTube, and find the channel. We have the YouTube channel, but find the playlist of successes. Go to our website and listen to the people that are actually treating these parasites. Like even just from our diet, we're having more symptom improvements than what these researchers are having giving these participants, like putting a catheter into their brain, injecting stem cells, giving them immunosuppressive drugs so the immune system doesn't react to these stem cells, which are not their own. It's an invasive procedure, and just simple changes in your diet can really, really make a much bigger impact, because when you decrease the carbs through the Live Disease-Free diet, then the parasites are less active. We notice a decrease in the inflammation, and people notice a lot of symptom improvements. And those diet guidelines are free. They're on our website, Live Disease-Free, under research. You can go there, you can print off the cheat sheet, put it in your kitchen. I've got some videos on what I eat for meals and the guidelines. So we explain it, and the whole gist of it is to get your carbs low enough so that the parasites are not as active, inflammation goes down, and you feel a lot better. A lot more improvements than just these stem cells into the brain. So we have to, we need a paradigm shift in the treatment of multiple sclerosis and all chronic diseases. We need to help people to see that they need to take charge of their health. And that's what we help people to do with our Live Disease-Free plan. We teach you how to take charge of your health, how to play an active role in your health, so that you know what you need, so that you know which practitioners can help you and which ones won't. You know how to avoid spending $100,000 to $300,000 on your health and still being sick. You don't need a ton of testing. You do not need a lot of supplements. You just need to, number one, stop feeding the parasites so much. Number two, support the body by having daily bowel movements and making sure you're sleeping well, cleaning up your environment, looking at your blood work, supporting your physiology. Then you need to start treating. You need to start treating big to small. And if you're new to this work, we usually have a lot of large worms, roundworms, tapeworms, intestinal flukes. It varies from person to person. We also have smaller protists that we need to treat. That can be the Babesia. Sometimes we have E. coli, other different types of protists, also the bacteria and fungi. So think about it like a weedy lawn. When you have a yard that maybe doesn't have established grass, you don't just get one type of weed coming in. You have multiple types of weeds, and that's what happens in our intestines, in our digestive tract, when we take too many antibiotics and we don't have enough health-promoting microbes. Then the bad microbes, they get out of hand. So we have to knock them back. So I am disappointed. Let's say if I was an athlete, like a professional athlete, and I had an injury, and I was super healthy, and I was, eating right, and I was working on my microbiome, and I had no disease symptoms, but I had a physical injury. I may opt for stem cell therapy then, because those stem cells, when they're injected into your body, they're going to move to the areas that are damaged, or they might inject them in those areas, and that will help to regenerate tissue. That's a whole different thing. If you go for stem cell treatments, and let's say it helps to settle down the inflammation a little bit, you might have some short-term benefit for it. The problem is that those parasites are still there, and you're going to have more and more inflammation, and then all of a sudden you've spent $10,000 to $15,000 to $20,000 on this treatment, and you have to keep going back year after year with very, very limited improvements. Much less improvements than even just changing your diet very often. I have literally interviewed hundreds of people, and I have yet to have talked to one person that have said, wow, the stem cell therapies helped me so much, and I'm still 1, 2, 3 years later, I still have those benefits. I haven't spoken to one person about that. So it's another very expensive procedure. To me, it's a dead end. It's not worth it. Maybe if you treated the parasites and then you wanted to, use stem cell therapy to help regenerate, there again, your body knows how to heal itself. And I honestly don't know if we can do better than the body. So if you guys have any questions about that, make sure to share. Thanks, James. Hi, Cheryl. And hi, Natalia. So we're just heading into the new year here right away. We're heading into holiday season, then we're heading into the new year. And I want you to think about, what do you want this next year to be for you, 2024? What do you want for 2024? Do you want more of the same? Do you want to continue living the way you're living? And I talk to people every day, and it's awful what they're going through, very often in tears. And what I would say is that there is hope, there is a better way. You've got to treat the cause. You have to take a different path. You have to take a different approach. To do the same thing that hasn't been working, I think that's the definition of insanity. So if you're new to all of this work, make sure to check out our Live Disease Free YouTube channel. Also, what's even better is if you go to our website, livediseasefree.com, look at our blog posts, the blog post section. I cover a really important topic every week. And so you can look at the titles and you can pick and choose what's important to you, what information you need. And those videos that are listed there, so you'll have my notes. So every time I do a live event, I have my notes. So I put my notes there. And then we also take the video, get it edited down a little shorter. So there's shorter versions of the video and the written. And please share that with others. Share it with your practitioners. Share it with your different groups. Get the discussion going. Like, have you ever heard about parasites? Do you think parasites could be causing the disease I'm dealing with? And it doesn't matter if it's MS or cancer or a different autoimmune. It's a disruption in our microbiome. We have too many disease-causing parasites and not enough health-promoting microbes. Listen to the successes of people that are recovering. We have students, I don't think I have it up here right now, but students, we have our call, and it was last night, and some of our students are new, some of them are treating, but the ones that are new, just changing their diet, it's profound. And some of them are not even using or prescribed the parasite drugs yet. What we do is we first follow the diet, support the body, then we start treating. And by the time we start treating, we're feeling a lot better before we even start. And so we start with things like raw garlic chopped up on a spoon, small amounts working up. We use oxidizing agents, we use herbs while we're getting ready to build the game plan. We also use parasite drugs. So they have practitioners that are writing prescriptions to use different treatments. And it's the combination of all of it is where we've seen these amazing, humongous parasites that even I have passed. And all I can tell you is that when you pass them, you are shocked at how normal you feel. You're just like, I feel like 20 years younger. It's really quite shocking. And it doesn't matter if you have serious chronic disease or a lot of symptoms and you're on the verge of chronic disease. It's so important that the sooner you treat, the easier it is to treat, and the quicker our recovery can be. So Diesel, 2024, everything I can do for healing. So we've had a huge amount of people join our plan, the Live Disease Free plan, just in this month already. And that is so exciting because they're not waiting till the new year. They're not going to go through Christmas and binge on a whole bunch of food, because when you binge on carbs, those parasites are binging with you and you'll feel awful. So they're getting their ducks in a row before the holidays. They're figuring out lots of healthy, tasty things that they can eat so that they can go through the holidays, feel a lot better, enjoy the company with their loved ones, and start 2024 running. So if you are new to this, make sure to check out our website, livediseasefree.com, find the guidelines for the diet, start to implement it, and start to make a plan for the diet. Learn about the parasites, learn about all the different types. We have a section called research on the Live Disease Free website, and just scan. There's the abstracts of different studies. Watch Dr. Alan McDonald's video about the small roundworms. You can actually see them. This was in every 10 out of 10 MS subjects that he examined. You'll actually see the worms. Do you have those worms in your central nervous system? I don't know. It was in 100% of the ones he looked at. And then you can also look at our blog posts. You can see a lot of the worms our students have been passing. So by changing your diet, learning about the parasites, you're going to come to a place you're like, okay, Pam, thanks for all the free stuff, but I now want to treat these parasites. I'm sure I have them. I want them out of my body. And when you get to that place, make sure to watch my masterclass training, because on it, I share all the steps that we take to recover from a parasitic infestation that causes MS and all chronic disease. And what's so fascinating too is like cancer, there are many parasite drugs that cure or treat cancers. So one is albendazole. It will treat certain cancers. Ivermectin will treat certain cancers. Fenbendazole will treat certain cancers. So is cancer caused by a parasitic infestation? Absolutely. Just different types of parasites cause different types of conditions. Why are our doctors? They know this. It's in the scientific literature. Maybe they don't know it, but it is in the scientific literature because there's no money in treating parasites. There's a lot more money in the disease modifying drugs, in the chemo drugs, etc., in the whole industries that we have in place. And it's time for change. Do you agree? It's time for change. So make sure to watch my masterclass training. And if you're at that place where you're like, Pam, I'm ready, but I don't have a doctor, then join because we will help you to get access to all the practitioners and everything that you need and walk you through the process. So again, if you watch my masterclass training, you fill out the form, and then you'll get a link to the coachathon. The coachathon really explains in detail the plan, and then you can either join or you can book a time to chat with me. I will talk to you before we or when we start the journey together or before we start because I want to make that connection. I want to get you off to a strong start. I want this coming year to be the very best year you've had in many, many years, to be a turning point for you, a point where you're actually getting back, taking back your health in your life, starting to dream again, starting to make plans, and enjoying all the beautiful loved ones around you, enjoying nature around you, all your hobbies and interests. It is possible. Watch the videos from the students. So, with that, I'm going to let you guys go. I hope that you have a wonderful week. I'll be back next week. We're getting closer to the holidays. I might kind of give you some more ideas on how to make it through the holidays without compromising your health. But otherwise, if you enjoy these videos, make sure to like, share, and subscribe. And we will talk to you next week. Take care. Bye-bye for now.